You can imagine then my surprise when I looked up red clover online, and I found website after website telling me that red clover interferes with hormonal therapy, that red clover is not safe for women who have estrogen receptor positive breast cancer, that red clover has no effect on hot flashes, that those with hormone sensitive cancers need to avoid red clover because it contains estrogen, that red clover increases the effects of anticoagulants, that it needs to be avoided by any woman who's pregnant, thinking of being pregnant, breastfeeding, or thinking of breastfeeding, that red clover should be avoided by anyone with a bleeding disorder, that red clover should be avoided by any woman who's taking any hormones from birth control pills to hormone replacement at menopause, that it is not safe to use red clover if you're taking any other medication, that red clover acts like estrogen and affects hormone-sensitive cancers of the breast, uterus, ovaries, endometrium, and prostate, that red clover is very bad for women with uterine fibroids, that animals who graze on red clover actually become infertile, that red clover inhibits aromatase activity and expression, that red clover stimulates proliferation of estrogen receptor positive breast cancer cells, that red clover is damaging to the nerves, that red clover has no effect except perhaps a detrimental one during menopause, that red clover has no effect on cholesterol, that red clover has no effect on the bones, that red clover can inhibit the growth of healing cells, that red clover increases cancer, especially in the presence of radiation, that women with a history of breast cancer should not ever take red clover, and that patients with hormone-sensitive cancers should avoid red clover because it's loaded with estrogen. Oh, my goodness. How could it be that in using an herb for more than 50 years, I not only didn't notice these effects, but in fact have noticed exactly the opposite effects? This is an herb that I cherish for increasing fertility, for protection against cancer, for women who are taking hormone therapies to help moderate those, for people who are undergoing radiation, for strengthening the nervous system, for alleviating menopausal symptoms. Every single one of these things that I read online, my experience shows me just the opposite. That's why we're having a conference on red clover. It's time to talk some sense about phytoestrogens. Join me.